I'm Dr. Imtinene Ben Mrad, a cardiologist specialized in rhythmology practicing in Tunisia. I am honored to present to you this abstract video of our article entitled Heart Rate Variability as an Indicator of Autonomic Nervous System Disturbance in Behçet disease. BD is a chronic relapse and multisystemic vasculitis of unknown etiology. It has a worldwide distribution and is commonly seen around the Mediterranean Sea, particularly in Tunisia. Ventricular arrhythmias and sudden cardiac death are higher in BD patients compared to healthy population. The exact cause of this risk is unknown, and cardiac autonomic dysfunction may be one of the potential explanations. We aimed in this study to assess cardiac autonomic function by heart rate variability in patients with BD, to evaluate circadian changes in HRV, and to study the relationship between HRV parameters and disease parameters. We conducted a cross-sectional comparative study of 36 Behçet disease patients with no overt cardiac involvement and 36 matched healthy controls. Heart rate variability analysis was performed in the time and frequency domains for the entire 24 hours period and for the daytime and nighttime periods. We found that patients with BD had significantly lower values of SDNN compared to controls. PNN50, RMSSD, and high-frequency components mean values were significantly reduced in BD patients compared to controls, implying parasympathetic impairment. Low frequency was comparable between the two groups, whereas low frequency to high frequency ratio was higher in BD group. When it comes to morning and night periods, PNN50, RMSSD, and high-frequency component values were reduced in BD group. The value of daytime heart frequency to low frequency ratio was higher, and that of the nighttime low frequency component was lower in the patient's group. When comparing diurnal and nocturnal values of different HRV parameters in the patient group, we noticed that parameters characterizing sympathetic activity had higher values in daytime, and parameters characterizing parasympathetic activity had higher values in nighttime. HRV indices for patients with active BD and those in remission were calculated, and there was no significant difference between the two groups. There was no significant correlation between CRP or disease duration with HRV indices in BD patients. However, there was a significant negative moderate correlation between low frequency to high frequency ratio and Behçet disease current activity form score. Patients with Behçet disease, despite no cardiovascular involvement, have reduced parasympathetic activity compared with controls. However, circadian rhythms of autonomic function is preserved. There is strong evidence for the role of the autonomic nervous system in the pathogenesis of ventricular arrhythmias. Thus, being a practical tool, HRV can be an interesting approach for rhythmic follow-up of Behçet disease patients. Thank you for your attention.